Hey there, everybody. Welcome to the HMIS Lead webinar. We're going to get started in just a couple of minutes, give folks some time to come on into the meeting. While we do that, if you could take a moment to review our virtual code of conduct, we would super appreciate that. Thanks. All right, I'm going to go ahead and get us started. I think we're going to have a little bit of a smaller group today, probably just because of the change in the schedule. We had to move this month's call because there were some other conflicts. So again, welcome to the HMIS lead admin call. Super glad you could join us today. We've got a lot of really great content for you and an opportunity for you all to provide some feedback to us. So to get us started, let's talk about our virtual code of conduct real quick. These are agreements that we as TA and HUD are committed to in this space with you, and that we're hoping that you'll agree to as well. So everybody contributes energy to this space. We want to celebrate differences and enjoy this opportunity to learn from each other. We are committed to using accessible language, so defining acronyms and trying to avoid jargon, uh, listening for understanding, and to appreciate what all of you are sharing with us. And then just an acknowledgement that we have a shared purpose and that we're all part of the solution here. A couple of housekeeping things. So first of all, there is closed captioning available for this webinar. In order to turn that on, you can click the button in the lower left-hand side of your screen that looks like a little speech bubble with a CC in it. And you click the small arrow beside the closed caption button to select your preferred caption language. Everybody except for the panelists is muted on this call. So if you want to interact with us, you can do that through the chat feature. You can just send your message to all panelists. It's helpful if you can use a slide number if your question is in relationship to a slide that was presented, because sometimes there's a delay between when we get the question and when we get around to answering it, and it's helpful to have that context. Want to make sure you're all aware about the HUD Exchange website. All of the materials from these webinars are posted on that site, except for May and June of this year. We have a lot of requirements that we have to meet with these materials before they can get posted. We try to move that along as quickly as possible. However, we have hit some unexpected delays here recently that we are trying to work through. So just want to acknowledge that we owe you those materials and we are working hard to get those posted. On the Exchange site, you can also manage your listserv subscription, and you can get links to other HMIS information. And you can also go there to submit an AAQ, which stands for Ask a Question. Links for this webinar that we're providing here will also be posted on our Weebly site. And so Yoreli is going to be dropping a link intermittently into the chat for all of you to go there and find those links so you have those right away. Things to know about kind of the question and answer protocol on this call. If you have a question, you can send that in the chat. And then once it's submitted, we're taking that question, we're putting it in a shared document where we're all working together in the background to draft an answer for you. If you don't see an answer to your question, rest assured that we have it and we're working on a response. Please be patient. Sometimes we're like pinging other people that aren't even on the call to confirm information, things like that. So we're going as fast as we can. When we do answer questions verbally, we'll summarize the answer and post it in the chat during the meeting. Otherwise, all questions and answers are going to be posted in the chat. We do our best to answer all the questions that we receive during the call. If you've asked a question that wasn't answered, we will try to stay on the call and answer as many questions as possible. But if we run out of time, those questions will be answered in the Q&A document. And then sometimes the questions are of such a detailed and specific nature that we ask you to submit an AAQ so that we can make sure that you get the thorough response that you deserve. A couple of tips: you can save the chat from today's meeting so that we have that information more quickly than when we post the Q&A documents. In order to do that, you will click the file in the top toolbar and then click Save Chat. As we get to the end of the call, I will kind of slow things down a little bit and cue you all up that that's the moment to do that action if you want to do that before we end the webinar. If you have a suggestion or request for a future agenda item, you can send that to the email address that's on the screen. We're always happy to hear from you. We want to make sure that we're giving you the content that you need. All right, if you're wondering if you should be on this call, here's what we do here. It's all about homeless management information system and related data things. So we share upcoming events, information, and changes to guidance, provide broad overviews of guidance and foundational knowledge, provide a forum for questions from the field, remind communities about upcoming reporting deadlines and requirements, and provide leadership for implementation success. So if that sounds like your kind of thing, you're in the right spot. For today's agenda, we're going to go through our announcements and reminders. A couple of highlights here. Fran has a reminder for everybody about personally identifying information. Also going to provide a Summer Institute debrief. That institute was just yesterday. And then some information about data exchange and API. We will then get into our deeper dive content, including a feedback session with the HIC and PIT team. And then Meredith is going to take us through a deep dive around APR, CAPR, SAGE-related matters. We will wrap up the call with Ureli talking to us about how to handle a head of household that's leaving the household. So we sometimes do some review of material because it's something that we are aware that is often confusing, or we're starting to get a lot of AAQs in about that particular topic. So that's what that section's all about. Okay. The recurring cast on this call. So we have Fran Ledger from the SNAPS office, they, them. From Apt Global, I'm Jesse Jorstad, he, him. We also have Ureli Salgado, she, her, and Miriam Carlone, for she, her. From Cloudburst, we have Alexa Timrick, she, her, and Max Burns, he, him. ICF, Alyssa Parrish, she, her. And from PCL, we have Meredith Alspa, she, her. Few guests on our call today, all from Apt Global, including Sean Morris, he, him, Cicely Wonkska, she, her, and Tanya DeSouza, she, her. Okay, I'm going to turn it over to Fran.
Hi, everyone. Thank you for joining us today. I'm very excited that you're here. It looks like we do have a good crowd going. So for new system administrators or system administrators that need refresher in some areas, we like to point people to the resources that you see on this page. This offers a lot of foundational information and places that you can go to get support outside of this call. So I encourage you to go and look at these documents, visit these pages. There's a lot of helpful information. Let's jump into the reporting. So we have quite a few things that we talk about in our reporting timeline. We break it out monthly, quarterly, annually. For our monthly reporting, it's SFVF, so Supportive Services for Veteran Families. There's a monthly report. It's due between August 1st and August 7th. That's the next one coming up. For quarterly, we have the remaining ESGCB quarterly reports and the YHDP round 4, 5, and 6 only, and special NOFA quarterly reports. Those are due July 30th. And then our RHY quarterly reports, which the upload period is July 15th through the 26th. And for HIC and PIT, that is closed, and the data cleaning is in process. You're going to hear more about HIC and PIT information coming up, as Jesse mentioned. So now I'm going to spend a minute talking about PII. And so you've heard this conversation before. If you've been on this call, we've had some situations where occasionally we have a community that will accidentally submit PII when they're seeking assistance. So we have a lot of different avenues in which you can request technical assistance or support. Maybe it's you're running into issues submitting a report, or you have some questions. And so it happens in a variety of ways. It can happen through someone trying to submit something through the AAQ, or you're trying to, you have questions about your HIC or PIT or something like that. And so a community may send a file and it actually has PII in it. That is a breach. So that is an unauthorized disclosure. And we absolutely don't want to see that. And it triggers all kinds of things on our end. So we have all kinds of protocols. And I shouldn't say we, like HUD does not receive PII, but the organizations you're sending the information to. So whether it's the HIC PIT review team, or it's through the AAQ and that goes into the HUD exchange, all of these organizations have protocols that they have to follow if they've received PII that they should not have received. Your organization should also have breach procedures. And if you don't, you should be adding those to your privacy notice and your privacy policies. They should be there. And heads up, you're going to hear about this in just a second, HUD is working on, right, the COC program rule. We've talked about that a little bit, and we're writing language that will address breaches in the future because they're so important. So on that note, sharing is caring, but not in the case of PII. So personally identifying information, let's not have that go out. Make sure that you are being very careful when you're managing information. So yes, that SpongeBob is right. I'm on my knees. Please don't send it. Okay. Let's move on from that. Upcoming events. We have the data analytics courses, on-demand courses. So you're working at your own pace. There's a broad kind of timeline, but it's like you're working at your own pace through it. We've had lots of cohorts now go through this. It's a great opportunity. So consider that. There's a sign up there. And also the fall conference for NHSDC has been announced. And there's the dates up there, and registration is open. So we'll flash up there the registration information page for you. But it is October 21st, 22nd, and 23rd. HUD is going to be doing quite a few sessions during that conference. We're going to be doing two institutes and then quite a few sessions. You can use your funding, your COC and ESG funding, that is your HMIS funding award, to help cover the costs of attending conferences that are HMIS content related. So the NHSDC qualifies for that. So you will have the link to be able to go and check that out and see if that's something that you have interest in. Let's go to the next slide. So this is what's going to be in there. So we're going to be doing one session in the Institute that's going to be focused on how to engage with people with lived experience and expertise in your data decision-making process, and then an HMIS Fundamentals Institute. So those are our two institutes. They're not large. So if you do want to register for those, you want to register for those early because those fill up. And then we have our regular sessions that are a part of the full conference. So that is a list of the sessions that we'll be offering. And then we have a lab that's open the whole time where you can ask questions that are individual questions for your community. You can go and sit down with somebody and talk to somebody. So that is it. I'm going to spend just a moment talking about the spring the summer virtual session that just happened yesterday. And I hope some of you had an opportunity to attend. It was very interesting. We just did our kind of largest or longest session on the API. So I'm going to talk for a few minutes about that. But I made some kind of general broad announcements that I wanted to bring back to you guys. And these were also announced at NAEH in both like the listening sessions, and Norm Suchar, our director, also talked about them. So this information is getting peppered kind of in a lot of different places, and your COC lead organizations may have heard about it. Providers may have heard about some of this information. So it's important that you guys are all aware of this information too. So first thing I'm going to say is we're very interested in artificial intelligence, AI, and we are encouraging communities to be thinking about this. So over the next couple of months, be considering about what initial step you can take to prepare towards AI, thinking about like what do I need to be doing in my community to prepare for this. It can be small steps, like commit to learning something about AI, embracing curiosity, balancing optimism with potential risk. So really engage in learning and understanding those things are important. HUD is going to be investing in producing AI resources and being able to build capacity and knowledge for COCs and HMIS leads around AI use. That will be coming out, and we're excited about that, but it will be a little bit before we can get all of that content to you. And so in the meantime, we want you to be thinking about AI, as some of you already are. You already have some practices in place. You may already be figuring out how to use that. So we want you to be thoughtful about that use. I mentioned the data standards engagement for FY26 and FY27. We mentioned that we're doing kind of a different process, right? Minimal things are going to happen in 26. Our general data standards update will be in FY27. And we're going to be making sure that we have broad engagement, but we'll also have some special efforts to do very specific outreach and engagement. We will provide a lot more information on that through this call. And also we'll occasionally make listserv announcements, so you'll be kept aware of all the avenues that you have to engage in that process. One of the things I brought up was APR CAPR confidence. This is new information. Your vendors don't have any more information than I'm giving you right now. So when I tell you this, don't call up your vendor and ask them what's going on, because they will have no information for you. So for APR and CAPR confidence, HUD is investing in making sure that the APR and CAPRs that you're using are accurate and reliable for you. And so what we've created is a certification that the APR and CAPRs are validated through SAGE. And this is going to be an opt-in process for vendors. It's not a required process. So vendors will have an opportunity to go into SAGE, test out their APR CAPRs, make sure that they're all working accurately. They get certified, they can opt into then publish that certification. All of that's got to be worked out. We are just introducing this concept. We'll be working with the vendors in collaboration with them about this process, what it looks like to roll out. This was announced at NAEH, and we are now making you aware of it, and we're just making the vendors aware of it. And so, yeah, we're excited about it. But this is new territory for us. So we'll provide more information for you soon. And the last thing I'll say is it's not listed on here, but COC program rule. It ties into a lot of this conversation. We are working on it. I have mentioned that before. And we're looking to take things that were in the 2004 data and technical standards and updating that information into the COC program rule. That includes all kinds of stuff: governance, privacy, security, technology. And a part of that plays into what I'm going to talk about in just a minute. So let's go to the next slide. It has to do with API. So this is kind of the new area. Oh, yes.
Sorry, Brent, I'm going to jump in real quick. Could you
Yes.
clarify HUD's stance around AI a little bit in terms of like, is HUD saying we should use AI to the maximum extent possible, go wild, AI is amazing?
No.
Okay, just checking it
Not
out.
at all. We're saying caution, caution. We're saying that we're saying be thoughtful and prepare, not take action. Learn, be curious. We're not saying run wild and implement all kinds of things. We're going to put resources out there to help educate community. We're going to listen to what communities are already doing. We know the AI field is much more advanced. Often HUD is like behind, right? So we are trying to help communities, move forward and take away some of the scary things around what is AI and what does it mean for me? What can I do? What I shouldn't be doing? How can I be thinking about privacy? Where is it really? Could it be beneficial in the work that I do? And where do I need to be concerned? So we want to help with those things, and so we'll be helping to support communities in that. But with all of our technical assistance materials and products that we produce, it takes us a little bit to get that stuff out the door. So in the meantime, we just ask communities to start thinking about it, educating yourself. We'll be talking more about that in the fall. Maybe a session on it. I don't know. At least bigger conversations from HUD in the fall on that. So API, HUD is going to be supporting API as a standard. And so that will be part of what goes into the COC program rule. APR, if you were on this call a few months ago, you heard about API, so Application Programming Interface, and it allows automatic connections and syncing between different platforms and software. What we're doing is it's baseline. It's a baseline standard. Some communities are already doing APIs, and they're can be very sophisticated and very specific. What HUD is trying to do is to standardize something that would be useful for all communities and is something to build from. And what we're seeing is we know the benefits of HMIS around aggregate reporting and analysis, the things that we do around system performance, the reporting we have to do for Congress. But what we're hearing is that frontline staff, providers, participants around coordinated care really need some assistance to make sure that they're connecting to information so it reduces the burden that they're seeing at that level and connects people at the right time to the information that they need to make good decisions to bridge people to the resources that they need. And so this is a step into that work. And we expect that, that the communities will build off of this API stuff. So we talked about API yesterday at length. That was the bulk of the presentation, the plenary that we did. And you'll have these slides for you to refer back to, but I just want to quickly go to the next two, and then I will hand it off because I know I'm taking longer than I expected. So this one is the Impact to System Administrator. So this is another tool in your tool belt. The CSV is going to be there. So if you have to do bulk transfers and that kind of stuff, that remains. But this allows you to do things that are more finite, streamlined, and it's bidirectional and can be in real time. And it's just a different way of thinking about how you interact with data and do data exchange. You still have to think about all these important things that underlie anything that we do with data exchange. What does privacy look like? What does data usage look like? Data ownership, all of those things that are primary conversations you should be having anytime that you exchange data, whether it was through a CSV file or something else, you'll still be having those conversations. And then next slide. So what can you be thinking about? And we'll provide more information on the API as we go. But think about use cases. How could your community, if you're not already doing anything with API, how could your community benefit from the use of API? The other thing is, what are things that you need to be thinking about if you started to engage in the use of an API? Know that HUD is super invested in providing resources for communities to be thinking through some of these questions around data exchange. We are already in the development of resources to help communities prepare themselves for data exchange, how to have those conversations with partners, making sure they have the right people at the table, that they're addressing the privacy concerns, and how do they think strategically about planning out those projects. So there'll be assistance and support in that way. The API reference is already available and accessible. It is a very technical document. We do not expect most system administrators to be able to read the API reference, but maybe you can, which is great. But if you don't, that's fine too. It's not the intent. But if you want to take a look at it and comment on it, you certainly can. And the data lab is there to then respond to comments that they see. We'll drop in a link to the API reference. Again, it is a baseline that HUD will be supporting over time. And there's a lot of people that are excited about it. It's people have been wanting to figure out how they can connect to mainstream benefits, healthcare information in real time, so they can know, has my person already received services from this other place, or do I need to help them apply for those services? And you would quickly be able to see, yep, they're already in that system. Nope, they're not in that system. I need to connect that to that system. So yeah, we're super excited about it. And we have a lot of support from other federal entities to support this process too. So great stuff. I'm going to hand it off.
Thanks so much, Fran. All right, I'm going to go ahead and invite Cicely and Tanya and Sean to the floor, and we'll go ahead and start with Cicely for this section.
Hi, everyone. Going to go to the agenda slide. All right, so
is this your first HMIS admin call?
It is. It is.
Welcome.
Yes.
So good to have
everyone.
you
here. Thanks. It's great to be here. Okay, so I just wanted to talk through a little bit about how we're going to move through this session. So we'll just do some brief introductions of our team. I want to talk through how we're going to collect your feedback during this session. We're also going to have opportunities for you to continue to give us some feedback after this. We'll do an update on where we are with the data cleaning, and then we're really going to dive into it. Sean's going to talk us through getting your feedback on communication, how that went, some analysis that we've done on the AAQs that we've gotten. We want to talk a little bit about our testing processes, any other topics that you want to bring forward. Certainly want to get your feedback on anything you want to give us feedback on. And then I'll just do a quick recap and we'll talk about our next steps. All right, so quick intros, and then we'll let everybody jump in when it's their turn. So my name again, Cicely Wanska. My role is really to kind of oversee the HDX 2.0 platform at large. We are getting more and more modules that are coming onto the HDX 2.0 platform. So I work with the individual module teams and then kind of overseeing that entire platform. And then we've got Tanya D'Souza, who's going to be joining us. So she's the lead on the HCPIT data collection and cleaning team. She's also part of the small but mighty HCPIT AAQ team, has been addressing some of the feedback. And then finally, Sean Morris, who's going to be talking through a majority of this. He's just been a key member of the HCPIT module development team, in addition to some of the other ones that we are running on the HDX 2.0 platform. So he's been, architect, designer, business analyst, tester, and he also responded to AAQs. So we're happy to have him on the call. Okay, so in terms of mechanics of getting feedback, we're going to be monitoring this chat. So certainly send us chat messages during the presentation. We're going to do our best to get through and answer everything that we can. May not be everything. So we also set up an email address that you can, especially if you have feedback that's maybe more than can be a chat, but we didn't want to make everybody go through AAQs. So we've got this email address. Certainly you can capture it, and we'll bring it back up again at the end of the slide. So anything that you want to continue, if you think about it after the fact, we want to have that opportunity for you to provide that feedback. And again, we'll definitely read everything, and if we can't respond to it during this call, we will respond to it on a future call. Hand it off to Tanya.
Thanks, Isley. So just a quick update from the one I provided at the June call. So data cleaning for the 2024 PIT and HIC is still underway. We have been able to close out many COCs, and we're still working on closing out a few with the goal of getting all our responses in at the end of this week. Your data liaison is still your best resource for specific questions you have around the PIT or the HIC or any of the data cleaning issues that we are working with you on. So that's still going to be your ahar_region 1 through 10 at global.com email. Also want to just give a big thank you to everyone who's been working with us on this data cleaning process and for responding to all of our questions so timely. So thank you for all of that. And then at the end here, we just have a quick little graphic about the timeline for this. So, you know, the HIT submission was March through May. We are working on finishing up the data cleaning period this month. And then I know that the NOFO, or the Notice of Funding Opportunity for COCs, is coming out soon. And we are working through our processes to get those competition reports ready for you in time, and a distribution mechanism for those. So just be on the lookout for that.
Okay, great. Thanks, Tanya. So I think also we should just let everybody know that some information about HDX 1.0 closing is also going to be, was published, I believe, last Friday on the listserv. So Meredith, if you wouldn't mind just sharing a link to that in the chat, I think that would be helpful to folks. Otherwise, we'll just continue with the feedback session. Thanks, Tanya. So next up, we're going to kind of step into the feedback portion. I just wanted to introduce myself briefly and then kind of get us started by way of these two analogies of the two different roles that I played on the project and kind of the project more generally. So the first role that I played was as kind of a web technician, and the second was as a project manager. So I kind of saw the world in these two different ways. As a web technician, I really saw myself as one of these engineers that you see on the image, which is that I, along with Tanya, was on the AAQ desk, which means that every time we saw an issue, our job was to look at it under a microscope and then to make sure that we were fixing it or building it in some cases as the plane was flying. So in that sense, I'm kind of an interesting person to be leading a feedback session just because I have such a unique and acute sense of what was going wrong with the system. Yeah, that is what it is. So on the other hand, I was wearing this project manager hat. So with Tanya, Sicely, and Jules, my job was to oversee the construction of this new system. And I say new because the system from 1.0, although it was built before, the code base was so old that it actually wasn't easy for us to repurpose. So we had to basically recreate it from the ground up. And basically start from scratch and nail it on the first try. So the image that we've been using to communicate about that has been this giraffe. So the image that we have, it's basically, this is a giraffe just moments after it's been born. It's fallen 7 feet from the womb, and then it's expected to get up and start walking so it doesn't get eaten by a lion. So this has felt appropriate for us just because if you ask me how HIC-PIT went this year, I have to say, honestly, I know it was rough, right? It was a rocky start. And it didn't feel great necessarily, but we are just getting on our feet. I take solace in the fact that it has been the case with the LSA back in 2018, for those of you who remember, and also with the HIC-PIT way back in 2007 when that system was opening in 1.0, that the first year is the toughest and it gets better and better every year. So basically, this is just to say that we trust that this giraffe is going to grow into a beautiful animal that's going to serve all of us in the future. So that's all to say we just have 3 main points for the session. The first is that we just want to communicate that we really understand that this wasn't an easy year, and we really want to thank you for your patience. that's the second point. We just really want to thank you, everybody, for being so patient and generous with your time as we were working through some of these issues. Tanya and I on the AAQ desk were seeing so many of them. And the thing that I just really want to say is I just so appreciate people's tone as they're giving us feedback about some of these things. I find generally that people's tone in the AAQs is just very sincere and very much interested in helping and contributing to something that we can all use and be proud of. And then the third point is that we just really want this session to be about communicating to you what our priorities are for making the system better and better in the years to come. Okay, so with those analogies out of the way, now I just wanted to take a step to talk a little bit about testing. So we just wanted to talk about this explicitly, just because we know folks have had questions about it. So to kind of frame this, I just wanted to talk about our two biggest headwinds with this project. The first is that the window of time between when the data standards are released and when the system opens is very narrow. It basically means that in that time, not only do we have to communicate with all of your vendors to make sure that they have the right specifications, we also have to configure our system to be able to get them in appropriately. And right now, we only have been giving ourselves, we've only been able to take about a week to test that happens. That basically means that otherwise, we'd like to, that is to say that in the future, we'd like to extend that period so that we're not subjecting you all to issues that your vendors or we couldn't have anticipated. The second big headwind is that because we want to give ourselves time to test fixes, we have a release schedule that is about a week and every week. So we typically post on Thursdays or Fridays. We produce releases on Thursdays or Fridays. So our testing team has our own scripts that they use manually to test critical system functions from end to end, and we're very much interested in automating this. I know the folks that are on the testing team will really appreciate this in the future. This will help them stay sane, but it's also going to help us deal with some things that I know that some folks here ran into, which was regression. That's just when you fix one thing and then it ends up breaking something else in the system. So that's totally something we're interested in producing in the future. And then the third thing that we're interested in working on to make sure that the system works better and generally next year is to work with our colleagues at ICF and the data lab to basically elaborate some more test data sets. Basically, this would be a set of ways to give the system some stress tests before we take off. So this would help us deal with some strange issues like unexpected characters that showed up in the system that we didn't have particularly good error messages about. So it would reduce even the back and forth that we have between people like Tanya and myself and the development team that we then need to communicate with you all about. So those are some of our testing priorities for next year. In a minute, we're going to talk a little bit more about specifically what we know were your problems, just based on our perspective from the AAQ desk, and we'll ask you all for a little bit more feedback about that. But before we do that,
I'm going to jump in real
Sure.
quick, just to talk about HDX 1.0 just a moment before we move forward. Could you clarify, is there any way to get a full export of a COC's HDX 1.0 data before it closes? Or like, what are some of the options there if COCs feel they have data on there they need to keep?
Yeah, so there's no single option for one kind of omnibus report. You'd have to go into the reporting tab and then individually select the reports that you'd want from the given modules. So that is the ones that would matter would be the HIC, PIT, the SPM, and the AHAR, although there's a lot of reports there, and that the AHAR is basically discontinued because it's been replaced by the LSA. So most COCs would never need to do that. It's only for the data geeks among us who are really interested in even more comprehensive data. But what's published on the HUD website is, for all intents and purposes, what most people would ever need for their data needs.
Thank you so much.
Sure. Thanks, Jesse. So because we're a little bit behind, we'll keep things moving here. So the next thing we wanted to do was just talk, before we talk about the AAQs, just talk a little bit more about the communication channels that we were relying on over the course of the submission period to communicate with you all. So the first thing is the HUD Exchange mailing list. I'm sure most of us are already on that list, but if you're not already, then somebody will include it in the link in the chat along with the links to the Weebly page and the AAQ. This is basically where the high-level announcements will come about the system opening and closing deadlines and also the extension of those deadlines. So because it's so high-level, what's even more useful than that is the banner messages that will show up in the system. So those will be often they're blue messages that show up. Sometimes we can change the color so that there's if there's bigger issues, we can make it yellow or even red in some cases. And that would be in the banner message that I'm sure you would see even right now if you logged into HDX on the home page. In fact, there's an announcement about HDX 1.0 closing. So these are kind of more timely and targeted announcements that also include system issues, like we know certain things that we know are not functioning and certain things that we want to encourage people to not use because they're not working properly or as expected. And most significantly on the banner, there will be that Weebly page URL is included too. So that's really the bread and butter of how we were communicating with you all. And again, just thank you so much for your patience about that. So just to recap how the Weebly page was working, basically there were three main sections. There was a section up top which had a whole bunch of information about other kinds of announcements, requests for things to keep in mind as people submit AAQs, other kinds of information about things like changing your CFC primary. And then below that, there was a yellow table that was the outstanding issues table. So that was things that we were actively diagnosing, things that we had known were problems that we were dealing with and our programmers were working on, or that we had already dealt with and we had tested and were preparing to release. So if you go to the Weebly now, just a note, you might see that there's still some things in the outstanding issues table, and that's just because basically since the system is closed, we've stopped updating that. But those are in a lot of cases, those are things that we've already, as data cleaning has gotten underway, those are things that we've already addressed. So below that intro section and the outstanding issues table, then there was the resolved issues table. So this was a green table that when we tested something after we pushed it to the production environment, the live site, we moved it into the green table so that folks could know that something that they may have asked about on the AAQ it was actually addressed. So we just want to say kind of explicitly, I know that the Weebly it basically requires a lot of work on y'all's part in order to be able to keep up to date on things that should be working better. And we just really thank you all for your patience in monitoring that. Another thing that I appreciated so much was when people took an honest look at what was on the Weebly page before they submitted a question. So much of the backlog that we were dealing during the submission period was just because we needed to remind people that sometimes things had already been addressed. So as far as the AAQ is concerned, that link is available at the footer of any page in HDX 2.0, and I believe some of my colleagues have already included the link to that. It's just a very helpful way to get a specific question addressed. And so one of the things that we'd like to commit to for next year is when you submit an AAQ, there's a message that says that things could take between 7 and 10 days to respond. That's just basically because of all this diagnostics that we have to do to look at it under a microscope and really make sure it's an issue that we can fix. So looking forward, we'd like to really stick to that 7 to 10 day window. In some cases, because we knew things were getting resolved, we would wait even longer so that we could basically put out the bleeding on other problems, and then respond to people in mass in other cases. So that also explains why some of our messages you might have seen were a little bit more terse, just because by the time we were able to respond to things, often the problems that folks were reporting on were already addressed. So that was some of those basically were the communication channels. Again, thank you so much for those of you who are monitoring the Weebly. As the system matures and grows, we expect that just like with the LSA, it will be less and less likely for us, or less and less necessary for us to need to rely on something like the Weebly because the site will just work a lot better. So with that said, then let me jump into the kind of nuts and bolts of the feedback session. And so that's just us. Basically, we conducted a kind of a thematic review of the AAQs. So we went through a ton of the AAQs and just took a look at some of the issues that people were facing. So each of them we could categorize into at least one of these 6 categories. So we wanted to just take a moment now to review each of these in turn, and then ask for you all to give us some feedback basically about how you were experiencing these things, and otherwise just kind of give a nod to the fact that it's true that these were in fact problems. So as I go through each one, we'll then just take a pause just to note what's in the comments there. So the first one was about saving and reliability. So again, we could have coded any one response in multiple ways. So it seemed like something like a quarter of all of the issues had to do with saving issues. Okay, so this had This included editing fields and having them revert to previous values, flags not resolving or disappearing properly. So what a lot of people perceived to be flag issues were in fact what we diagnosed as saving issues, just because in some cases when edits were made, it wasn't the case that that was getting written to the back end of our database, such that those flags were themselves also getting cleared out. So those of you who were especially around for the last couple of weeks of the submission, probably some of you at least may have been exposed to these guidance that we included in the Weebly page, which, by the way, is different from the Weebly page that Jesse mentioned at the beginning. This is the HDX 2.0 issues Weebly page. About clearing your local storage. So one of the biggest problems that we ran into was that basically the data that lives in the back end, what you interact with is kind of a prototype of that data, such that you can save it or you can revert some other changes. We needed to be able to do that because in some cases people need to overwrite their own changes. So in some cases that save button wasn't rendering correctly in such a way that it was getting written to the back end. And that was basically resulting in a lot of other problems. So we know that that was a huge issue for a lot of folks. We just wanted to maybe now just take a pause. And I know my colleagues are reviewing what's in the chat now. So if other people wanted a chance to express themselves or other kinds of issues they were seeing, let me just say, as folks collect those and as those responses come in, we totally get that this was a huge headache. If folks are not able to properly save the records that they're interacting with on the system, it leads to this big sense of mistrust, even with the system in general, and basically a lot of paranoia. That was certainly the case for me. So that's something that we have a huge priority to address in the future years. So this is the kind of thing that we're looking to deal with proper automation, and then just making sure that we have some testing scripts that really get to the bottom of this. So maybe then I can just take a pause there, and Jesse and other folks who are monitoring what's in the chat can let those pop up. Let me just remind everybody that although we might not be able to respond here to everything that's being said in the chat, we are absolutely planning to report on everything that's said and reading everything that's said in future HMIS calls.
Yeah, I haven't seen anything come in yet that I feel like we need to kind of address now. So I think we can go ahead and just keep rolling. But we really
Great.
appreciate all the comments.
Yeah,
Thanks.
yeah, great. I can see those coming in. Right. Okay. Yep. And I see other comments. These will be things that will be addressed in some of the other things that we're going through. So we'll just keep moving then. So the second big issue was the HIC upload. So thankfully, from my perspective, this is really where the plane was flying, right? Just because we had so little window, such a small window of time to be able to test things properly ahead of time. Early on, the HIC upload, because of a lot of hiccups with the vendor issues and our own specifications, a lot of HIC uploads weren't getting in. And even worse, we weren't getting really good information from our error messages about why not. So these were the kinds of things that by the end of the submission period, thankfully, it was very much the case that people were successfully able to get uploads in. But it wasn't painless on the way in. So it still was the case even late in the submission period that some fields from the upload weren't getting mapped properly to the fields that they expected. One of those, for example, was the overflow beds, but those were other things that we were able to correct, and things that you would have seen in that resolved issues on the Weebly page too. So I'll just pause there also for other messages of their feedback about the upload procedure. Jesse, I'll just let you popcorn things. I know you've been monitoring that a lot better than I have.
Yeah, I think that there's not a lot coming in that's surprising that we need to really comment on right now.
Okay,
So I think you can go ahead and just keep rolling, and then I'll pause you if I feel like there's something that we do want to kind of chat about now.
Okay, sure thing. Okay, so we'll keep moving then with the access issues. So this had to do with the inability to submit. I've already seen some people comment about that. Total headache, right? Thank you so much again for those of you who were responsive and wrote to us in the AAQ to just say, hey, I'm the submitter, please submit on my behalf. So this is another thing that proper testing can totally do for us. It basically, one of the reasons it's complicated is because there's 5 different types of users, each with their own gradations of access in the system. And you all, the community users, are just one type of those. So when we test permissions for the access to certain features, we actually have to test a whole suite of things to make sure that it's working for everybody in the way that we intend. So another huge thing that we're having as a priority for this year, for next year, that is, yeah. So I'll keep moving, Jesse, as you directed. So another one was flag issues. So these were, I would say, other things that had to do with kind of hiccups related to the data standards changes and basically just moving the system to a new system. These were basically just issues with the with flags. So flags might have been referring to erroneous data sources. In some cases, they're referring to previous year's submissions. So we had to get information from 1.0 and then to be able to refer to it on the back end. So in some cases, those weren't showing up correctly. In other cases, it was the fact that flags couldn't actually be clicked in the screen because the small window that was showing up was not wide enough to actually show you the button that you could click on the flag with. So that meant that there was a flag that it wasn't possible to lead a comment on. Okay, so I'll just pause there too, just to see what folks are saying briefly. Yeah, thanks to those of you who are weighing in. Yep. Yeah, we've just got comments again, I would say about like the upload procedure and realizing that that was difficult at the beginning but got better later. So thanks folks for those comments.
One thing that might be good to chat
Sure.
about for a second,
Yeah.
Fran, if you're on, can you talk about how we get into a situation where HUD is clearly messaging there's not going to be an extension, there's not going to be an extension, and then there does end up being an extension? Like, what kind of accounts for that?
Yeah, so we have a lot of kind of internal decision makers first that go into our ability to make an extension or not make an extension. And then sometimes we have some rules that exist that are outside our office's ability to make an extension. So sometimes those get in the way of, even though our office would like to make an extension, we're not permitted to do so. And so sometimes that becomes a challenge for us. And so we're often stuck in the position in our office of figuring out where do we have flexibilities and where do we not have flexibilities in doing that. So we try to be very thoughtful about the challenges that we're hearing from communities when they're trying to submit by a deadline. And if we're seeing a trend of folks having issues or concerns coming up, is this a type of deadline that we can be flexible on, or is it not? Or can we figure out a different kind of creative solution to what's going on? So does that get, Jesse, at what you were talking about? Okay. Yeah, we want to be as responsive as we possibly can.
Yeah. So I'm seeing, thanks so much, Fran. I'm seeing a lot of other good stuff in the chat. Tanya and Cicely, feel free to weigh in too. I would say, yeah, another issue, I would say, yeah, we can even segue into the next one, had to do with performance. So we were seeing some performance issues, particularly with those large COCs with huge uploads. And so that's another thing that we've already been talking about with some of our senior developers on ways to kind of optimize the processing of those things. It happened with the uploads, but also just with the pages rendering themselves when they got in. So that's another one of our big priorities for next year. Okay, and then the last piece, I'll just keep moving. I'm very much looking forward to digesting more things that folks are sharing here and in future calls, again, with that Outlook email address that we provided. The last part is the policy questions and others. This was basically just a catch-all for other kinds of questions. We have the HICPIT at HUD.gov for other kinds of policy questions. So a lot of what came into the AAQ really should have belonged in that direction, and we were trying to divert things over there. That basically goes to William and Fran's inboxes. But otherwise, these were kind of catch-all issues for other kinds of access, other kinds of issues, including access things that kind of fell between or people just being unclear about things. So thanks so much to everybody for your feedback. And yeah, we're really looking forward and are super committed to making this a smoother process in the years to come.
All right, I just want to come off mute and kind of wrap this up for all of us. So I've been watching the chat. Thank you so much for everybody who's provided feedback. I think this has been dropped into the chat, but definitely we have this email address as well. So if you want to continue to provide feedback afterward, you are welcome to do so. We would really welcome that, actually. We'll plan to compile all of this great feedback and report out on it on a future call. And, you know, I just really want to echo what Sean was saying. You know, really thank you so much for, you know, all your hard work. I know this has not been an easy year, so I just want to just thank you, appreciate it. I appreciate your partnership and patience with all of us. So looking forward to next year. So thanks, and I'll hand it off.
Great. Thanks so much to all of you on the HICPIT team and to everybody watching the webinar today and providing this valuable feedback. It's so helpful for us to hear what's working and what's not. Okay, let's go ahead and go over to Meredith.
Thanks, Jesse. Hey, everyone. All right, so we are going to get into a SAGE APR CAPER submission deep dive, though I think it might be a shallow paddle is what I called it, because we are running a little bit behind schedule here. But I do want to get into some bit of detail around the APR and the CAPER. This is in part because I think to what sort of Fran was talking about earlier, talking about CAPER, APR, well, I can't remember the word they said, but reliability, right, and understanding the information that is in the APR and the CAPER. We wanted to make sure that you all were aware sort of what exists right now, how SAGE validates APRs and CAPERs right now, what sort of tests happen before that data is able to be uploaded into SAGE. Also wanted to talk a little bit about the actual contents of the APR and the CAPER. Couple months ago now, I guess, when we did ask for your feedback on what you all wanted to hear in these calls, there were quite a few of you that wanted a deep dive into the APR CAPER specs, kind of surprisingly, but you know, we'll give the people what they want here. So we're gonna give you what you want and talk about the APR and the CAPER in detail. So like I said, we might not get quite as in depth as I had hoped, but the content will be in the slides. So it will be posted to the sysadmin hub, for lack of a better word, on the HUD Exchange. You will be able to get into it. You will be able to see it. And of course, all of this information is also available in a variety of different places on the HUD Exchange, in the programming specs and the guidebooks, et cetera, et cetera. So you will be able to access all of it. So let's get into it. So the COC program annual performance report and the ESG program consolidated annual performance and evaluation report, the CAPER, were first combined together into a single HMIS report back in 2015. Some of you may not have been around when those didn't exist together in the same report. So that report was combined back in 2015. That's about the time, right, when all of the federal partners agreed to come together and start working together, start collecting HMIS together in a standard way and start using HMIS. That's when sort of the data standards as we know them in the format of the dictionary and the manual and the program manuals, all of those things started coalescing together. That's when all of those materials came together. That's when the APR came together. And that's APR was designed to meet the requirements for the COC program and for the ESG program, but it's not really limited to just those funding sources. And if you've read the ESG CAPER programming specs, I wish I could like see a raise of hands who's read the specs. If you've read them, you'll see it actually even says in there that it's expected that the APR can be run on any project in the HMIS for local review and analysis outside of funding requirements. So it's really meant to be sort of a catch-all kind of generic report that can be run on a variety of different projects across your system. I like the APR for just that purpose, so that you don't have to have special reports for every single different kind of project that is set up in your system. Shout out to whoever put the hand up in the chat. So I just saw that pop up. So everyone should have the APR CAPER programmed in their system, right? And you should be able to use it on a variety of different projects. Hopefully all of you do know that the APR programming specs are updated each time the HMIS data standards are updated. HUD does provide the specifications to the vendors about 6 months before the report becomes effective. The specs do define the project type, client universe, and relevant HMIS data standards, data elements for every single question. So the programming specifications are literally the instructions for how every single question in the report gets programmed. It is, again, in excruciating detail, how to handle every single bit of information that is in all of those tables. The new version of the APR always becomes effective at the start of the federal fiscal year, so on October 1st. If the data standards are updated every 2 years, then the APR is updated every 2 years. There's almost, I can't say never, but almost never is the APR updated when the data standards are not updated. So they're almost always updated at the same time. But either way, it's always going to be updated on October 1st. As part of the data standards process update too, you do know, for those of you that have been around for an update process, vendors are provided with mapping guidance and users are provided with back data entry guidance to ensure that data completeness so that you can generate the current version of the APR and CAPR. So this is why it's so important that this mapping and back data entry gets completed so that all of the data gets put into the most current format so that the most current version of the APR is able to be generated on that data, right? So if we've moved data, if we've got new response options in the data standards, for instance, new exit destinations, those new exit destinations are going to be in the new version of the APR. In order for the APR to work, those exit destinations need to be in the right place, right? So we need to have all of that mapping in place or that back data entry in place so that the APR works on October 1st. There is only ever one version of an APR or a CAPR active at a given point in time. So on October 1st, Sage will only accept one version of an APR. And I know a lot of you have felt this pain if you don't have the right version of the APR available on October 1st. So, you know, this past year on October 1st of 2023, Sage would only accept the Sage would only accept the FY 2024 version of the APR. We will only ever accept one version at a time. This causes confusion. We know this causes confusion, but it has been this way for many years. There is only one version as of October 1, 2024. And it doesn't matter the funding year in which the project was operating. It doesn't matter the funding year of the NOFA that funded the project when it was running. It is always going to be the same fiscal year report. So it's always going to be, like right now, the FY 2024 version of the report. That is one we get a lot of questions about. That's one that we work really hard with the vendors on also to make sure that the naming convention of the report is clear and that they archive old reports when they're no longer effective. Because sometimes, you know, a casual user that's only going in and running their report once a year maybe isn't paying attention to this part of it, right? And so making sure that they only have one choice to choose from is going to be really important. And making sure as part of maybe your training process with them that they know which report to choose is also going to be really important. Digging in a little bit about the APR specifically. So the COC APR is required for projects that receive COC funding. That one is pretty straightforward, but it is also required for YHDP funded projects. It is also required for unsheltered rural special NOFO projects. It is also required for HUD's Pay for Success projects. Again, it can be used for other projects, but those projects that are funded by those particular programs are required to use the APR. APRs are always due in Sage 90 days after an operating end date. Now, keep in mind, there are some of those projects that have quarterly reports that are due. Those are going to be due 30 days after the end of the quarter, right? Excuse me, after the end of the quarter, but we're specifically talking about APRs here. In the case of APRs, recipients are required to submit the APR in Sage. We know that a lot of times HMIS leads get roped into doing this, but it is the responsibility of the recipient of the grant to submit their APR in Sage. The APR file, the CSV that comes out of HMIS, consists of 72 files. There should only be 72 tables. There should only be 72 tables in that zipped CSV file. Sage will not accept it if there are any more or any less than 72. When there are multiple projects associated with a grant, so there are subrecipients, or perhaps for some reason you've just decided in your COC to break apart a project into multiple projects, that's fine. If you have chosen to do that with one single grant, the expectation is that a single report is generated, that all of the projects are bundled or it's aggregated. The single report is aggregated across all of those projects, creating a single CSV for all of those projects that is then uploaded into Sage. Now, it is certainly possible that you might need to have two uploads. Let's say you have a victim service provider and a non-victim service provider that are both part of the same grant. That's fine. You can upload more than one CSV to Sage. Perfectly allowable. But when possible, the preference is definitely to aggregate it in the HMIS to do any deduplication that may need to be done directly in the HMIS. Now, when we're talking about the CAPER, it's going to be a little bit different. So the CAPER is required for any projects that receive ESG funding. That's going to be ESG CV if you're still one of those few communities that have ESG CV money, and ESG Rush. That's going to be for those that are in the presidentially declared disaster areas. Very limited circumstances that you would have Rush, but any of those ESG funded programs, they're going to be using the CAPERs. CAPERs are due in Sage 60 days after the end of the program year. And for CAPERs, the ESG recipients are required to submit the CAPERs in Sage. Subrecipients do not log into Sage. Subrecipients are not responsible for submitting the CAPERs in Sage. Subrecipients only need to submit the CAPER CSV through a special link that they will receive via email into Sage. They don't have to log in, they don't have to user account, they just have to click on the link they get in their email and upload their report. That's it. It should be very simple and straightforward. They should not be logging in, they should not have to do anything else within Sage itself. The CAPER is the same report, except it's only 42 files. It's not, or tables, I keep saying the wrong word. It's only 42 tables instead of 72. So it's a shorter version of the report. The CAPER is a little bit different from the APR2 in that it is expected to be every single project. It is not expected to, their users are not expected to aggregate the projects together. So if the ESG recipient is funding 4 different shelters, for regular ESG, the expectation is that there's 4 different shelter uploads, 4 different CSV shelter CSV files get uploaded into Sage. Again, separating ESG CV from this, not bundles. ESG CV is a totally different sort of thing. With ESG regular, it's going to be a file per project, and it's going to be uploaded. Each project has their own link that the file will be uploaded to, that the subrecipient is responsible for uploading. I want to talk just quickly about the upload and validations. So many of you probably know this, but maybe not. When recipients go to do their upload, Sage is testing the uploads before accepting them into the repository. They will receive validation errors if there is an issue with the file when it is being uploaded. Typically, the validation error will instruct the user to contact you first as an HMIS lead or system administrator. Very often, the issue has to be resolved by the vendor, but we are not telling users to contact vendors directly. So, and it doesn't actually it doesn't have to always be corrected by the vendor. You very often can help them resolve the issue, but we do often direct them to reach out to you. There are a handful of different types of errors. On the screen here, you can see a couple of different examples of why the user might get that type of error. So they might get a structural error. That might be because the zip file has too many tables in it. So it might have 74 instead of 72 in the APR. It might be that one or more of the tables has an extra column or an extra row. It could be an other type error, meaning maybe Sage identified what potentially could be PII. Harkening back to the beginning to what Fran was saying, we have an unfortunate number of attempts of uploading PII to Sage. People trying to upload the HMIS CSV. So if Sage sees anything that might even possibly be the HMIS CSV, even if it's possibly a hash CSV, we cut it off right there and don't accept it any further. Sage will also reject a CSV if it's the wrong project type. So Sage knows what kind of project type to be expecting in the upload. So if Sage is looking or expecting a rapid rehousing CSV and the user tries to upload a transitional housing CSV, Sage will reject it. Sage is also going to look for some basic calculations. So doing some basic validations on totals. We're not validating subtotals, but we are validating totals to Q5, which is the validation table. So if you had 25 levers in the operating period, for instance, the expectation in the exit destinations would be that you had the sum of levers was 25, right? So the total levers was 25. So just some really basic things like that. Also looking to make sure that any of the questions that had percentages were not in excess of 100%. Couple more things on the validations. So Sage is validating uploads in stages. So again, first thing we're looking for is PII. If you pass that, super. Next thing we're looking for is structure. If you've got the right number of tables, rows, columns, awesome. If you don't, we're going to boot you out, right? That file is going to get rejected. We're not looking at the totals. We're not looking at the calculations, the percentages, etc. So it is possible that you had an issue with the number of files. Your upload was rejected. You may have also had calculation errors in there, but we didn't test for that yet. So you may fix the file issue, upload it again, still have errors. So these are all going to need to be addressed in stages as Sage is reviewing them. But you will receive a listing of all of the validation errors that can be emailed to the user. That user can forward it on to you. You can forward it on to your vendor, however that needs to work out. Detailed information about validations on each question is available in the Sage APR guidebook. Literally every single question has an explanation of what the validations are. HMIS leads, vendors, you all, recipients, anyone can test the reports at any point. On the main page, sagehmis.info, upload a report anytime. Do any testing that you want to do. Again, though, please remind your users, don't upload an HMIS CSV to Sage. Never, ever, 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 ever. I want to talk just about this table, and then unfortunately, I think I'm going to breeze through the rest of them so that we can make sure Ureli has a few minutes to get her content in. But we can talk about this more at a future call if we need to. Q4A is one that throws a lot of folks off. Q4A is pulling mostly project descriptor data elements, but this is one where you all probably have a lot of ability to impact what kind of errors folks are getting here. So this is pulling in, right, those project descriptor data elements. So org name, org ID, project ID, project type, rapid rehousing subtype, the coordinated entry access point, affiliations with residential projects, et cetera, et cetera. One error type we see quite a bit is rapid rehousing subtype. So this seems to be one that maybe the sysadmin or HMIS lead just didn't fill out. This is one of the new elements from FY24 data standards updates. So making sure that you all have this filled out could save folks a little bit of headache. Because they're getting their reports rejected for it, and they can't necessarily do anything about it. We get quite a few of these in the comparable database space. So making sure that if you're a comparable database provider or if you are a comparable database user, that the PDDEs are filled out on your side as well. So again, sometimes this requires the vendors to do, sometimes it's just as simple as having a system administrator get this filled out as well. This having the project types accurate here is also really important. There also, if you are running this across multiple projects, like for your APR, there will be a row for every single project this is run across. So don't be surprised if there are multiple rows if you are running it across multiple projects. And then finally, this is Q5. This is the reports validation table. This is the table to which all other questions are validated back to. So when you look through this, the SAGE APR guidebook, it will call back to one of these rows specifically. So like the veterans questions will call back to the veterans, stayers will come back to the stayers, leavers back to the leavers, etc. So that's going to be in here. I think then with that, I'm going to just jump way ahead here and say all of this information is available on the SAGE HMIS landing page, reporting repository landing page on the HUD Exchange. You'll find the SAGE guidebooks, you'll find the SAGE table shelves, you'll find the links to the report specs. You will find a lot of different APR information. We have some recorded trainings about the APRs and how to use SAGE and all of that good stuff. And again, if we need to circle back and do this real deep dive on all the questions at a future call, we certainly can. Yeah, I'll stop there.
That's great. Thank you so much, Meredith. There was one thing I wanted to mention. So somebody was asking about what steps would HUD recommend if vendors are understanding the APR specs in a different way than the system admins are. And so, you know, I think always starting with a conversation with your vendor is really important. But if there, you know, continues to be, you know, disagreement about the definitions of things in the specs, or the specifications rather, you can go ahead and submit an AAQ and get a more thorough review and make sure that that can get reconciled.
Definitely.
All right. I'm going to pass it over to Ureli.
Thanks, Jesse. I am gonna, okay, let me take,
I'm trying. I don't know what's happening.
I think
Oh,
I
there we
got
go.
it.
Okay, cool. Thanks.
All right, so a frequently seen AAQ recently has been what to do when the head of household leaves the household. And that might seem simple, but there have been a little bit of nuanced scenarios that we wanted to talk through. So when it's very simple, right? When a head of household leaves the household, while the other household members remain enrolled, then you would just designate another person in that household as the head of household and change the relationships to the household members for the new head of household. But there have been a couple of scenarios that come through where the head of household had an earlier start date than their household members. So you can see on the right here on this table, client A was the original head of household. They started in the program earlier than their spouse, partner, and child, but then they exited the program before their household members. So what do you do there? So unless your system is capable of handling two different heads of households for the same household at different points in time, then you will need to backdate the start date of the remaining household, the new head of household. So you can see here, client B's original start date was 5/1. That is being backdated to 4/1 because you can't have, you have to have exactly one head of household. And if the original head of household leaves, then you have 0 heads of household for that month period. So backdating the new head of household start date to the first start date resolves that issue. And we recognize that's not perfect, right? It'll increase client B's length of stay, but it does give a more accurate count of households. So that is something we've seen come through quite a bit. So then you would just want to make sure that the relationship of others is adjusted as well as well as the relationship of the original household member. So you can see in bold the things that were changed: relationship to head of household for client A and client B, and then the start date for client B. All right, Jesse, back to you.
Thank you so much, Ureli. Okay, we are going to go ahead and start wrapping up this call. So each month we provide this slide and we update it as we go along to make sure that you all are aware of the most recently published resources in case you didn't see them on the HUD Exchange listserv. So the last one was in June. There's a new cost calculator to help with cost estimates for project types for Stella M. And then we are going to see you back here on August 21st, which is back to the third Wednesday when we typically would see you all. You can take a moment right now to go ahead and save the chat as we wrap up this call. Yeah, Fran.
What do you call a fish wearing a bow tie?
I do not know.
Sophisticated.
Amazing, amazing. I love it. Yeah, good one, Fran. Thank you.
Right?
Yes, absolutely. We actually do have a couple of minutes here, and I do see that we have a couple of questions that are outstanding. I'm going to read them real quick to myself and then see if we want to address any of them on the call. They're all about head of household stuff. So let me take a quick peek here. Okay, I think it's going to be easier if we just go ahead and respond in text. So we'll stay on the line, but we'll all go off camera and go on mute. And then we'll throw these in the chat as soon as they're ready to rock. Thanks, everybody. We'll see you in a month.